All right, well, I'll call this meeting to order. We'll start with the consent agenda. All the following items which concern reports and items of a routine nature normally approved at AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all of these items. The consent agenda consists of the discussion, consideration, and action on the following items. Minutes of the monthly finance meeting on July 21st, 2015. Minutes of the special trustee meeting on July 28th, 2015. And a check report July 9th, 2015 through August 8th, 2015. I'd entertain a motion.
I move we approve the consent agenda. Second.
We have a motion by Dr. Brown, a second by Bo Hannaford to approve the consent agenda. Roll call vote, please.
Brown?
Aye.
Klein?
Yes.
Gaspar?
Yes.
Hannaford?
Yes.
Next item is the CEO's report. Candace? Huh?
Just making sure we have a quorum.
We do. There's
Okay.
4 of us.
Okay. Well, I don't have a whole lot. I'll just be very brief this evening. Kelly Parker and Shannon Rose met with the Northwestern's football coach and went over in their staff and went over and discussed some concussion training and testing that can be done. And so they're going to be working on that. I think that's a great thing that they're offering for those student athletes. Upfront collections still remaining up there around $35,000. Clinic total charges were up. And you can see the other statistical information for some of the other departments were up as well. EHR attached, like right behind my report, you can see some of the EHR metrics and where we stand on some of those things. Still awaiting CMS's ruling whether that's going to be for just a 90-day period is what we're hoping for, but still have not heard on that. They're also working on processes for the e-prescribing of controlled substances. We've been working on, of course, we've got Dr. Smith recruited, who will be here on September the 14th. Maintenance is working on the clinic downtown. Dr. Berig's old office, getting that repainted and new flooring and countertops and such. When Dr. Smith comes, our plan is to have him here working out of the urgent care clinic 5 days a week while Gwen is on maternity leave. And her plan is to take about 8 weeks off. So somewhere around the 1st of December, Gwen will be back, and then we'll move Dr. Smith in downtown. And Lindsay will go down there with him as well from Dr. Kinsey's clinic, Lindsay Head. So we look forward to that. Do any of you have any questions for me? I will be taking off. Today is my last day here for a while. I plan on taking, I don't know, I'm going to say 6 weeks off. Probably won't be able to stay away that long. But I'll have surgery on Thursday and get this knocked out and be back.
All right. Any questions for Candace? If not, I'll entertain a motion.
Motion to approve the Share Medical Center written report for August 18, 2015.
Second.
A motion by Terry Klein, a second by Bo Hannaford to approve the Share Medical Center written report for August 18th, 2015. Roll call vote, please.
Brown?
Yes.
Klein?
Yes.
Gaspar?
Yes.
Hannaford?
Yes.
All right. Next is the CFO's report.
Okay. For the month of July, we had $308,401 cash on hand at the end of the month. That represents 9.4 days of operating expenses. Accounts receivable for the hospital increased by $79,183 for the month of July. We're at $2,626,165. Gross days are 60.4 in July compared to 58.7 in June, and our net days are 43.7 in July compared to 43.3 in June. Our accounts payable balance was $580,086. That represents 43 days of operating expenses. Our gross revenue increased $120,071 for the month to $1,733,101 or 011. Hospital seen the largest increase. It increased to $114,390. Nursing home charges increased by $25,840, and the homestead decreased by $46,358. Total patient days for July were 70 compared to 76 in June. Hospice days were 165 compared to 180 in June. Nursing home, the average daily census went to 55.7 compared to 53.4 in June. We wrote off 46.1% of our charges to contractuals for the month of July. Accounts written off to collection agency was $82,135. We had no charity care for the month of July. Our operating expenses increased $16,599 to $440,904 for the month of July. Our net operating loss for July was $133,680, and our net loss after sales tax was $18,485. Really, all the areas seen huge improvements compared to the prior month because, like it's $170,000 improvement from last month's net loss. A lot of that is due to one area is we did get rid of, and we're starting doing the business office now internally. That saves us $10,000 a month, so that was a savings there. Of course, with a little bit less charity care and stuff like that as well, and our contractuals improved. If you look on page 2, you can see that our net operating from all three operations, like I said, was $133,680 loss, $18,485 for all three entities together. Turn over to page 5 is the hospital's income statement. We posted $1,390,000. We lost $127,589 from operations, and with sales tax and everything, we lost $13,420. Page. If we go over to page 8, the income statement for the nursing home, they've seen a large increase in their revenue. They increased another, like I said, $26,000. They posted $290,014. That was due to the increase in census as well as their intensity of care for their nursing home or their skilled patients. That actually helped improve their revenue and stuff. They only lost $7,908 from operations, and even after their contributions, they lost $6,883. Page 10 is the homestead. They actually made $1,819. Page 11 and 12 is your accounts receivable. There's really no change. You know, since we took over, we haven't seen really much change one way or the other. The only line item that's up is our Medicaid is up. The unbilled is, or the billed out to Medicaid is because there was an issue with our CLIA certificate. We was waiting for it to get back we were inspected and everything, but until we actually got the true CLIA certificate back in hand, Medicaid won't pay for it, and we got that back in first part of August. We got all those claims built out and stuff, so you've seen a couple of months there as far as waiting for that certificate to come back. So that should actually go down. That was the only really increase in the accounts receivables, mostly in the Medicaid area. So page 13 and 14 is your balance sheet. And the last 4 or 5 pages is your graphical sheet as far as statistics. Is there any questions?
What is that? What is the fiscal year?
It's July 1st through June 30th, so we're just starting a new fiscal year. The auditors will be here in 2 weeks, the very last week of August, August 31st. And they'll come out to do their audit. It takes them about probably 2 months. Probably in November we should get our audit report back, hopefully.
Emergency room visits seems to have just plateaued.
Yeah, they've really plateaued. Yeah, they've been running about 250 every month since urgent care came in. Of course, the clinic visits increased by about 50, so urgent care and our other physicians, they continue to see an increase in patients coming to see us. So,
Kevin, just a quick question. On the
Sure.
homestead on page 1,
Yeah, that's,
The revenue said decreased by,
yeah, that's not, that's a mistake. When I read that, I thought that's not right. It actually,
because when you said the other one, was the
yeah,
increase.
it should have decreased 21,000. I'll have to correct that.
Okay,
Because it was 73,000 in June, it was 52,000 in July, so,
okay.
so that was a
Thank you.
mistake, yes.
Yeah, because it was going off of the June,
Yeah.
May to June instead of June to
Right.
July.
Yeah.
Yeah, I got,
Okay.
and also, contractuals look a little bit lower this month. I should point that out. The reason is, this is every quarter we have to make the shop payment is $67,000. So what I have to do is I have to post a credit to the contractual allowances of $67,000, but then you get the expense and the other expenses. So other expenses is up $67,000 due to the shop payment, but it was reduced your contractuals by $67,000. So overall, your contractual is probably, if we didn't have that, is right at 50%, which has been normal. So.
And this might be more for Candace maybe, but the clinic total visits, they're up 95. I mean, is there a,
Some of that is probably sports.
Some of the sports physicals,
Okay.
we started doing those, yeah, too, in there.
which I
so.
think is a good idea. So,
Mhm.
yeah.
Are there any other questions for Kevin in regards to the financials?
What month did we start urgent care last year? Was it
October.
October.
Okay.
Mhm.
Almost getting a year.
Yeah, it's almost been a year, yeah.
What, about 3
Yeah.
No.
You're an outsider. Outside looking in. No, it's been good.
Okay, no other questions, we'll move on. The next two items, Kevin, I don't know if you want to talk about this or I can, doesn't matter, but, so, when we made a change from, OMRF and we did away with that plan, the thought process was at that time that people could technically leave their money in there if they chose to do so. They just no longer were going to be mandatory to contribute to it. However, OMRF is making changes as well, and they're changing who their assets are managed by. And so because of that, we literally got a notice this last Thursday?
Yeah, Thursday, yeah.
Thursday, and that's why this is on here, to have to make changes. However, in conversating with them today, if one, we didn't have enough information, we didn't believe to be able to have a vote. Second part is, either way, the monies have got to come out of there, whether it is just a different timing on this. And so we're going to have to look at setting up some other type of policy and then a fund, probably at like a local bank, to be able to hold the monies until people get their monies out of there. So Rick, actually, we need to talk to you afterwards about, from a legal standpoint, what all we would need to do. Because they're just gonna dump the money.
Do that.
Huh?
They can do that.
They say they can.
Yeah.
And so we've got to be prepared for it, and it's just really whether it's about 30 to 45 days or whether it's about 90 days away, they're gonna do it either way. So at this time, we want to table these two documents until we can basically get some more information and try to make some decisions. So I would need a motion to table.
Motion to table resolution 2015-002 and 2015.
No, it's gotta be one at a time. Sorry.
2015-002.
Second.
We have a motion by Terry Klein, a second by Bo Hannaford, to table the resolution 2015-002. Roll call vote, please.
Brown.
Yes.
Klein.
Yes.
Casper.
Yes.
Hannaford.
Yes.
Kinsey.
Yes.
Okay, now I'd entertain a motion to table the next resolution.
Motion to table resolution 2015-3.
Second.
We have a motion by Terry Klein, a second by Bo Hannaford to table resolution 2015-003. Roll call vote, please.
Brown.
Yes.
Klein.
Yes.
Casper.
Yes.
Hannaford.
Yes.
Kinsey.
Yes.
Okay. All right, next, Medical Staff Executive Committee. Dr. Kinsey, do you have anything?
We did not meet this month,
Okay,
so I have nothing.
you have nothing. Everything's going well, though.
It makes it easy that way.
No complaints.
I honestly can't remember why we didn't meet.
Because Dr. Self wasn't here and I wasn't.
There you go.
All right. Dr. Kohler didn't meet by himself.
He
No.
wasn't a quorum. He was down here eating lunch.
All right, very good. Well, thank you, and also keep you and your family in our thoughts as well. Next is, we don't have a coffee report either, unless one of you guys, no? No? All right. We'll
I told you
just,
we were gonna get over it.
by golly, it's gonna be a cookie. Improvement to patient care, do we have anything for that?
That was, all of those contracts were
Contracts.
reviewed and satisfactory.
Saw that.
Yeah, let's put that behind.
Improvement to patient care.
It's just the name of it doesn't really coincide with what it actually is.
But
Basically,
everything's
contract renewal, review and renewals. And some of them aren't actually renewals, we're just required to look at them yearly to make sure, just to remind us to reflect on it and make sure that those vendors or whoever it might be are in compliance with what they say they're gonna do.
Validation spelled wrong. Sorry, it's a thing.
Spell
Spell
check.
check.
Must have missed that.
Are there any questions in regards to the contract review of quality evaluation? If not, we'll move on to Rita. Rita, how are you?
Good.
Good.
It seems like we were just here not very long.
We were.
At that time, I think I reported the State Health Department was doing their annual inspection. Completed that inspection and their comments at exit were, we had a very good survey and our residents are happy. So that was good to hear. We have a few things to fix and we'll work on those. I believe I got those yesterday in the mail, so we'll start working on those. Our bathtub is sitting in the lobby waiting to be installed.
Yay.
So, and Kelly wants to put a curtain up and use it first, and he can't. And we've had several, over the month, we've had a lot of admissions. We've also had a lot of discharges. We just discharged like 4 or 5. They're going home or to Kelly's place because Kelly and I have this agreement that if he gives me 2, I might give him 2 back. So far, it's working. And the hospital also gives us plenty, thank you. So, we have been busy this month. I foresee us being busy in coming months too, I hope. We have employees we are hiring. School has started. We have probably 10 nurses aides that are applying for LPN school that will start in October or November. We're anticipating anywhere from 3 to 5 to being accepted. If that happens, that's going to put a big hole in CNAs, but we do have, and I call for a new crop of nursing students coming in, and they are applying, and we are grabbing them up. There's been quite a few that's already been certified, so we don't have to burden ourselves with waiting for them to get through school. Staffing seems to be good. I have to say, over the past year, it has been a year, the staff have worked very, very hard. You know, we've had bumps, we've had little mountains and valleys and all those things, but they've withheld and done really well, I think. And I have to commend them. Of course, you know, they think I'm crazy. But I might be.
This is also your anniversary month? Right.
September.
1st.
September, okay.
I had 2 anniversaries.
She was freaking out about this time last year.
I was. Oh my goodness, I had a lot of things going on last summer.
For the facility.
For the facility.
Taking over the
February
job.
78, taking over the job
Yeah.
that been
I
last year.
thought for some reason I have in my mind that there was going to be some type of celebration or something.
Oh, yes, it is our anniversary this month, and that will come
Okay.
out. Sorry. My goodness. No, we just went right over it. I don't, 50, yes, we're gonna have a 50th year anniversary. It'll be in a couple of weeks, the last week of the month, just because it's gonna work out better for us.
Okay. All right.
Come and go, a couple of hours, put it in the newsgram, let everybody know.
All right.
No, we don't like to tell people we're getting old.
All right, well, thank you very much. Next, Kelly, homestead report.
I'm gonna let Reedy give my report. We had, July versus June was about even in terms of occupancy. Very, very slight increase in occupancy from June to July. We were a little bit down versus last year, less than 1%. But in the last, let's see, on the 15th of August, we had one move into a 2-bedroom apartment. Today, we had another move into a 2-bedroom apartment. Thursday, we'll have someone move into a studio apartment. And September 4th, we had one scheduled to move into a 1-bedroom apartment. And these are new residents moving in. We do have a few residents right now that are in both nursing homes here in town as well as facilities outside of town that are trying to get better from different things. And so hopefully we'll see them back before long. We, with the part of the city's budget, we were approved to have surveillance cameras put in at the facility, and so that system is going to be installed by Pioneer on August 24th and 25th, which is next week. And then we've also, the city's getting 2 washing machines for us to replace 2 of them that were, I guess, inefficient in their function. So we're seeing more residents and of course more laundry needs. So it's going to be real helpful to the staff. We've got 2 machines. It takes about an hour and a half to wash a load of clothes, which is too long for as much laundry as we have to do. And so those are being replaced. Other than that, we have a representative from Carson's Food Services here to do server training in our dining room. She's here today and tomorrow. And I think that's going to be about it. I'll answer any questions anybody has.
Any questions for Kelly in regards to the homestead?
Back to the siding.
The siding, I think, was a weather-related issue. There's a contractor has been called. We're waiting on him to come out. Hopefully get up there soon. I don't want to pull it off on it.
Is it a vinyl or something?
Huh?
Is it a vinyl siding?
No, it's a masonite wood type product, composite material.
All right. Next, Kelly, you got anything to report from the foundation?
I have one report that, or two things to report. One is that we're wrapping up the design and layout on the new donor appreciation art that will be in the lobby here at the hospital. And with that, we've accepted a pledge of $25,000, which Kevin and I worked to identify it. The donor and their family wanted something that was going to be able to be used immediately, last 10 to 20 years, and be in that $25,000 price range. And so it looks like if all goes well, and I think it is, we'll be able to get backup air conditioning system for the lab, which will, it's on our need list, so it'll save some money there.
Cool. All right.
Literally.
Yeah. All right. Thanks, Kelly. No Bridget, so I'm assuming no St. Anthony's report. Next, Bo, do you have anything to report from the city?
Just a couple things that would be of interest. We were approved last night to be organizing a partner with the AirMed Care Network that will allow our community members to come in and pay the one-time fee to be a part of that network. And also possibly, when staffing becomes a little bit better for the city, they might be able to put it on their water bill so they can pay it monthly to do that. That would be for the future. And then the feasibility study for the Integris Clinic came in. Our city manager will take that to the planning commission soon, and probably have a special meeting to get that done as quick as possible.
All right. Any questions for Bo? Not? Thank you. Next on my report, one item will be next month's board meeting. Instead of September 15th, we'll put it as September 22nd. That way that gives us a couple more weeks for get financials and that type of thing out. The only other thing that I have is we need to keep Candace in our thoughts and prayers, and speedy recovery. Stay home until you're healthy and ready to come back. All right. Any other items of new business? I don't have any. We're adjourned, folks.